We have with us today Rachel McRickard with Motivo. If you haven't heard about Motivo or didn't take a time to read the newsletter that was sent out, please know that this is truly potentially a game changer for Alaska. As many of you know, it's very difficult to find qualified therapists and counselors in Alaska. So often when we need these types of professionals, we have to hire them from outside of Alaska. And they're not always wanting to come here or stay. And so it's this kind of ongoing cycle of people who stay for a little while and then leave us. So to have something like Motivo that would allow counselors and therapists who are here, who want to become qualified, for them to be able to get the supervision they need would be truly a game changer for Alaskans and for their access to qualified therapists. So I'm going to say welcome to everybody, and I'm going to say thank you, Rachel, for joining us, and I'm going to just simply ask you to tell us a little bit about yourself and about Motivo.
Wonderful. Thank you so much, Jacqueline and Kim, for having me today. And hi to everybody who's on the call. Thanks for making time for this. I'm sure you guys are busy, especially this time of year, so I appreciate you taking time for it. I'm going to share my screen real quick, and I just have a few slides that I'd like to go through that kind of demonstrate who Motivo is and what we do. Let me put it in full screen real quick. Okay, can everyone see it there?
Yes, we can.
Okay, excellent. Okay, so I'm the founder and CEO of Motivo. I'm also a licensed marriage and family therapist. So Motivo helps therapists get the clinical supervision hours that they need for licensure. And I'll talk a little bit more about that in just a second, but I want to start with this SAMHSA statistic that says 55% of US counties, all of them rural, have no practicing mental health professionals. And one of the reasons for that is that because for therapists, they often have a hard time getting the clinical supervision and client hours they need to become licensed in their state. I experienced this process myself, so I'm going to tell you a little bit about my story. This is a picture of me at my graduation. I got my master's degree in clinical psychology from Azusa Pacific University in California, and there were two things that I didn't know on my graduation day. One, I didn't know that my graduation cap was on backwards, so no one told me that the entire day. And then two, I didn't know that it was going to take me 3 more years and $8,000 more in order to get the clinical supervision hours that I needed to get licensed as a therapist. I like to say that for a therapist, getting your degree is actually the easy part. It's becoming licensed that is so hard. And, you know, here was kind of the struggle that I went through. I was from a rural area of North Georgia, returning home after I got my degree, and I had to drive 2 hours to Atlanta in order to get to the closest clinical supervisor, and I did that every week for 2 years. And I think that this, I'm sorry, Alaska is missing from this map. I just noticed that. I was like, oh my gosh, I'm so sorry. But this is the process that a lot of people that go through, especially ones that live in rural areas and don't have a clinical supervisor close by. But I stuck with it, and I got my license in 2011. But then I saw in 2016, when Georgia passed a very clear licensure rule giving permission for something called telesupervision. And that is the ability to do your clinical supervision hours, which is just a new therapist. If you're not familiar with the term clinical supervision, it's the two years after graduate school. That's very similar to residency for a doctor, where a new therapist has to meet with a more seasoned therapist, their clinical supervisor, and staff their cases. So a quick disclaimer, because a lot of people think that clients are involved in these supervision sessions, that patients are there and the supervisor is watching the therapist do the counseling, and that's not it at all. It's only an appointment between the clinical supervisor and the therapist, and they need about 200 of these hours over the course of 2 years in order to get their license to practice on their own. So it's a career entry requirement. And so this rule, Georgia said, allowed for you to do all of your supervision through telehealth. You can meet with your supervisor online instead of in person. So telesupervision is now allowed in many states. And it gave me the idea for Motivo. So I created a platform that lists, we have about 465 clinical supervisors on our site, licensed in all 50 states, and they see therapists remotely for clinical supervision online. So we make the connection between the two. So telesupervision can also be called online supervision or distant supervision, remote or virtual, but it's basically supervision through a live two-way video conference using a HIPAA compliant medium. And I just want to elaborate a little bit on some of these supervision pain points that affect early career therapists. And I'm talking about marriage and family therapists, mental health counselors, substance abuse counselors, and social workers, and even sometimes psychologists that they experience on the road towards licensure. So it takes a lot of time and it's pretty expensive. And because it's so expensive, it takes them longer. So what should only take about 2 years ends up taking many therapists 4 or 5 years in order to get their license, simply because it's so expensive. So most supervisors charge their client session rate, which can be as high as $150 an hour for these supervision sessions. Our rates at Motivo are between $45 and $65 an hour. And then supervisor shortage. So for me, from a rural area of Georgia, there simply weren't any supervisors that were licensed marriage and family therapists in the area that I lived in. And so I had to drive to the closest one, and the closest one happened to be 2 hours away. And then supervisor fit is another one. So we created Motivo with the idea that we wanted to create more access to affordable supervisors. But what we're learning is that when you allow people to meet online for this, they're able to find the supervisor that fits with their unique specialty area. So if they wanted to work with LGBTQ youth, they're able to find a supervisor who specializes in that specific thing, and thus become a better, more clinically competent therapist because they're meeting with the right kind of supervisor. So it really doesn't just create more licensed therapists, it creates better licensed therapists. And then another point that I'll just make is that a lot of the supervision that takes place today is in the agency setting. So it's at community mental health agencies. And oftentimes those agencies are pretty strapped with their resources. They can't offer all of the supervision that they would like to, or they just don't have enough people on staff to really adequately meet the needs. So that's another struggle that people experience. So just in closing here, I'll say that clinical supervision online is really beginning to take off. And the reason for that is because boards, licensure boards are changing their rules on this as we speak. About 45 states allow it now. I'm sure you guys are curious, if you don't already know, what Alaska's rule on it. Alaska's licensure boards are thinking about this issue right now. But as it states today, for mental health counselors, I believe it is that you can do it, but you can't do it if you live in an urban setting. So you can't do it if you live in Juneau or Anchorage, but you can do it with board's approval if you live in a very remote area, but you have to go through the approval process first. And I don't believe for social workers or marriage and family therapists it's allowed at all yet, but they're looking at the rule right now. Also, there's advancements in video technology that's making it easier than it's ever been before. There's a rise of online education. So actually, one of our partners is Capella University, and they have a number of students in Alaska who are getting their education right now, but they won't have a path to licensure after they graduate without clinical supervision. And then really just the connected generation of new therapists. They're more comfortable with technology, and it's just an easy way to meet with a new career professional. So let me stop sharing there, and would love to just take whatever questions that you have for me about Motivo. Yes, so I'll stop there.
Well, thank you very much, Rachel. I think you've given us a very nice overview, and I completely agree. I think our landscape is changing. I think most of us are doing these types of meetings on Zoom. It just is natural now to be able to meet with people and be supervised this way. Can you tell me, like, what are the reservations that some people have when you present this to them?
Yeah, I mean, I would say that a lot of the healthcare in general has been slow to adopt new technology, and mental health professionals have probably been even further beyond that. And I think it's because mental health professionals are worried about it affecting the client relationship. So if I were to be a therapist who wanted to do all of my work online, a therapist is going to think about, like, how's that going to impact my relationship with the client. So sometimes I think that therapists, and I can say this since I am one, but I think they have a tendency to, like, throw the baby out with the bathwater as it pertains to technology. And they're like, oh, that's scary. I don't want, rather than thinking about this from the perspective of, if you're meeting with the right supervisor, you're becoming a better therapist than if you're meeting with the wrong supervisor who just happens to live down the street. So when they start thinking about it with that frame of mind, it changes their thinking a little bit.
I'm going to reach out to Kim right now. I know, Kim, this is an area that you are familiar with. Do you have any questions for Rachel or any insight for the state of Alaska and how we might adopt this?
Well, I was curious about the process for changing the licensing rules, and if you're actively working with someone in Alaska around that, or if there's something that we could do to reach out and support that, because I do think that it's something Alaska needs to figure out how to create flexibility and options for.
Yes. So here's kind of one of the struggles with making a lot of headway with licensure board members sometimes, is that licensure board members aren't usually like paid positions. They're therapists who are elected to the licensure board who have full-time jobs. So they're not just like waiting by the phone to like answer your phone calls about questions. So they have board administrators who kind of funnel those questions. And it's the same board administrator for the social work board and the marriage and family therapy board in Alaska. Her name's Lauren, and she's been super communicative with me. She passed along my question to the licensure board. The licensure board had me come and speak to them. I think it was in September on Zoom, and the social worker said, you're revolutionizing the profession. This is like so good for Alaska, and we're going to think about changing the rule. And so they're having me come and speak again to the social work board in January. The MFT board, I haven't heard anything from, but I haven't directly asked Lauren to like get me connected with them. And then the mental health counselors board, it's a different person. I can't remember his name, but his kind of stance on it, he's not been like Lauren has been about it. I'll just speak frankly. He's more been like, well, we have a regulation in place and there's no plans to change it. And the regulation in place is you can do it with board's approval if you live in a really remote area. It's better than nothing, but most therapists do live in an urban area oftentimes, and they still struggle to get to these clinical supervision hours because of traffic or weather or what have you. So that's kind of where it stands today.
Let's open it up. I know that there's others online who have some familiarity in this area. Does anybody else have a question for Rachel?
Well, this is Lizette, and I just so wish that we were, that we had more people from behavioral health background online, because I know that it's such an issue in the rural areas to get the supervision and keep people and provide support for them. And I just, wow. From a behavioral health standpoint, it just sounds so powerful as an option for people to be able to train, go back home, and then receive. So I'm really curious. I mean, I don't have any way to know, and I don't know that you know, Rachel, like how many people in Alaska are accessing the rural behavioral health option of supervision remotely?
It's a good question. Let me actually write that question down, and I'll send that to both Lauren and the mental health counselor, and follow up and let Jacqueline and Kim know. That is a good question. How many people are even taking advantage of that rule?
Well, and Jacqueline, I think about other health time meetings, and Kim, where we've had Jerry online, who is part of, Rachel, Jerry is like the operations manager for the Behavioral Health Association, the Provider Association. And I just wish we had somebody like that online today hearing this, because I just feel like this is so profound from a behavioral health standpoint.
I think that, Rachel, you might have spoken with Jerry Jenkins already.
I did. I met him at the NADAC conference, and he told me, yes, the board is looking at this issue. So that was good to me. And I think, I think what would be helpful from the people on this call is to send maybe even a message if you know somebody who is on the board or someone connected to the board or Jerry himself, and say, like, we support this issue, because I think that most states are more interested in what the people who live there say and think than they are with some company who lives in Atlanta, So I think you have some power there.
Yes, I agree. I think one of the most interesting things about Motivo and the work that you're doing is that I see that for Health Tie, this is something that we could really move forward and make a critical change, that we have the ability to reach out to the right people, both through this call, but also through the recording. And then literally with a change of a few minds, we might be able to introduce this in the next year in Alaska, and that's truly exciting. So
yes, and I'll say too, along that piece, this in most states, this does not go through the legislative process, so it doesn't need like a bill or anything like that. It's a decision that can be made at the board licensure level, and Pennsylvania is one of the 5 states that doesn't allow it at all under any condition. And I asked them once, like, why are you so resistant to it? And they said, it's not that we're resistant to it. It's just that nobody has ever asked us to change this. And so you guys are right in line with where other states are. Colorado's changing their rule right now. Texas just changed their rule from 50% allowed online to 100%. Kentucky just changed their rule to 100%. So you're not behind, at all. But it does take people to be able to see, like, oh, if it's allowed for one, it should be allowed for all. If it's allowed for 50%, it should be allowed for 100%, because it's not that much more helpful for me to only have to drive to Atlanta for a year versus 2 years. It's to me, it's just kind of an easy no-brainer.
Absolutely. Now, crossing state lines, is that challenging for some of the telehealth that you're doing? Are there different regulations and things that you're bumping up against that you need to address?
We don't cross any state lines with supervisors. So some states will allow you to supervise there even if you don't have a license there, but we err on the side of caution. So we wouldn't be matching pre-licensed therapists in Alaska with anybody who wasn't already licensed in Alaska.
Okay, interesting. All right. Are there any other questions from the group at all?
Yeah, actually, I do. I am a physical therapist as well. Thank you, Rachel, for bringing this topic. This is really amazing. It's so cool. And we just started physical therapy practice that has telehealth component of it. We're still waiting for licensure to come through. But as you say, the biggest roadblock I see is that public doesn't know about that. And in Alaska, within the telehealth portion of it, we're actually quite ahead of lower 48 because of the distances that we have. And the Alaska Native Medical Center is actually way ahead of the rest of the state. So if you need to look I don't know how the mental health component of that is functioning there, but that would be really awesome avenue to look into it. But so I have a couple questions for you. When you use your software, whatever system you're using, you mentioned that it's HIPAA compliant. What do you use, and how do you know that it's HIPAA compliant?
Yeah, so we actually use Zoom. So Zoom in and of itself is not HIPAA compliant, but it has a HIPAA compliant version. And so we have a business associates agreement with Zoom, and the API, which is the white labeled version of Zoom, is baked into the back end of our product.
Yeah. Okay, I'm familiar with that.
Yes.
Oh, excellent. Yeah,
Wow.
it's so cool what you do. I have several friends in Anchorage that went through the really hard 3 years of seeing clients and trying to fit themselves into somewhere where they can be supervised. So yeah, thank you so much for what you're doing.
Of course. Yes. Yeah. Thank you for that feedback too. Yeah, it shouldn't be this hard.
I know,
to become a
I know.
therapist,
And like you said,
with,
the board,
how much we need them.
Right.
Yes.
And the board, they do their own thing, whatever they're used to and whatever they've done for last 15, 20 years. And if nobody steps up and says, hey, this is an option, nobody's going to do that.
Yes.
And even now in physical therapy, and now mental health practice as well, there are apps and electronic medical systems that are HIPAA compliant. They're really, really reasonable in price.
Mhm.
So we just don't know about it.
Yes.
Yeah.
Yes. Yeah, agreed. Well, I mean, I think what the work that your group is doing to get this advocacy out and get the word spreading of these new technologies is what's key. I mean, I don't remember even Jacqueline. I think someone introduced me to you that I met in Charlotte at like a pitch competition. And I'm like, it just look at that, how that has spread to so many other people who need to know about it, It's great.
Yeah, absolutely. And that is the model that we're developing, where Health Tie will be a hub that really connects entrepreneurs like you with healthcare challenges in Alaska. I'd also, I invited Susanna Rogers to participate in this meeting today because she's an entrepreneur and she'll probably present to us in February or March. And so we're also looking at our local entrepreneurs and trying to just show that we have a lot going on here that we don't know about, and this might be the place where we can talk more about it. So so one thing that I'm curious about is about your entrepreneurial journey, Rachel. I mean, this has been really exciting for you to develop. Can you tell us a little bit about kind of where you're at in that process, and how one of the things that we see often with entrepreneurs, as you addressed earlier, is it's really hard in healthcare to get your foot in the door and talk to the right people. Any advice for other people who are coming behind you?
Yeah, I think finding a good accelerator program, so incubators that I'm not sure if there are some in Alaska. I would imagine there probably are one or two. I went through one called TechStars that was based in Boulder, Colorado. I know they have a TechStars Anywhere program. It's a completely virtual program. But I went through TechStars Atlanta, and the financial backer of TechStars Atlanta is Cox Enterprises, Cox Communication, the media group, and they have a big interest in digital healthcare and are beginning to make some investments there. So we just raised $2.2 million and they led the round. So we have investors from all over the country now, but Cox is a main investor there, and Capella University is another main investor for Motivo. And so that is really helping us accelerate our growth as an early stage tech startup. It's all about whether or not you have the money that you need to get the idea off the ground, because especially for software platforms, it takes a while to be cash flow positive. So you're just kind of living on investors' money until you can get enough traction to move forward. Yeah.
Awesome. Good. Great. Love that.
I will say that these are all really great comments too. Thank you guys for all these comments. I'm looking at all of them. I'm guessing AMH. I would think that means like Alaska Mental Health Therapist Association.
We have the Alaska Mental Health Trust, and then we have the ANTHC is the Alaska Native Tribal Health Consortium.
Okay.
So, and we can link you to some of that. Those resources.
I would love that. Yeah, because I will just say here, I know we're getting close to the end here, but most of what we started doing was helping people who were in rural areas who just needed to connect with a supervisor. But now what we're moving more towards is helping entire community mental health agencies connect to a supervisor. So if there are mental health centers that employ pre-licensed therapists, most mental health centers do employ pre-licensed therapists because you can bill Medicaid without a license as long as you're under clinical supervision. And so we come in and we're their clinical supervision outsourced solution. So we're working with a number of agencies in Georgia and California and Texas right now. And some of those agencies, even the ANTHC might be a good fit for that, because you can also do teletherapy in most states as a pre-licensed therapist as long as you're under supervision.
Wonderful. I think that with the group that's here, and certainly the Health Ties stakeholders, we have people that we can directly connect you to ANTHC. So now we're just about a couple of minutes away, about 4 minutes away. I want to thank Rachel very much. I think you've already addressed this, but what I'm hearing is what we can do for you is continue the advocacy and outreach. And is there anybody else with Kim? Would you like to say a final couple of words at all, or?
I think this is great. And I think that, you know, we'll get there eventually, but Health Tie will push it along as much as we can.
Yes. Well, and maybe what I can do too is send to you and Jacqueline and Kim just a quick snippet of what you could send to the licensure board, and I'll give you their email address as well, almost like you're like lobbying for something. And if you want to and feel comfortable, you could say, hey, I just learned about this, and I think this is a great idea that could help a lot of Alaskans. And if you want to do it, great, and no problem if you don't.
Oh, we would love to do that for you. Yes, please do that, and we'll share it with our stakeholders. So thank you very much. All right, well, we're at the end of our call, and so I want to say a big thank you to Rachel and to everybody that's here, and I look forward to seeing you all in the new year. You'll be hearing from us again probably the second week of January. We'll have a lot of news when we come back, so have a wonderful holiday until then, and thank you again, Rachel.